Welcome. This is an educational video showing an example of how to perform a recruitment maneuver and PEEP titration for the prime air trial. Starting at a baseline PEEP of 5 cm of water, the stepwise recruitment will consist of the increase of PEEP from 5 to 20 in 5 cm of water steps of 30 seconds each. The patient is now intubated with a PEEP of 5 cm of water and a plateau pressure of 15 cm of water. Notice that the yellow arrow indicating the plateau pressure on the ventilator screen is corresponding to the red arrow on the graph. The components of the inflation pressure curve are the peak, the plateau, and the PEEP. The first step is to increase the PEEP from 5 to 10. The plateau pressure now reaches 20 and eventually stabilizes at 22. You can use the timer in your anesthesia machine to monitor for 30 seconds. The next step is to increase the PEEP from 10 to 15. The anesthesia machine timer is used again. The plateau pressure now reaches 26. Next step is to increase PEEP from 15 to 20. Notice that compliance is 38 at this point. Notice that the blue arrow indicating the compliance on the ventilator screen is corresponding to the green arrow on the graph. In some patients, PEEP can be increased by 2 or 3 instead of 5 so that plateau pressures don't exceed 32. If this happens, you can reduce this step to a PEEP between 16 to 19 in order to keep that limit of plateau pressures. The second stage, starting from the PEEP of 20, is the decremental PEEP titration. During this stage, the goal is to find the PEEP related to the maximal compliance along the decremental PEEP steps. PEEP should be decreased in 30 cm of water steps of 45 to 75 seconds each. In our patient, we decreased the PEEP from 20 to 17. When we did so, the compliance increased to 41. And then, after 60 seconds, we went ahead to our next step and decreased the PEEP from 17 to 14. When we did so, the compliance increases again to 48. And then, after 60 seconds, we again decreased the PEEP from 14 to 11. When we did so, notice now that compliance reached 52.5. And then, after 60 seconds, we decreased the PEEP from 11 to 8. As we do so, the compliance decreases to 48.5, which is lower than the compliance achieved in the previous step. Consequently, the PEEP of 11 was associated with the maximum compliance and will be the PEEP to be used. In some patients, every time you decrease the PEEP, compliance increases. In such case, the minimum PEEP allowed will be 2. The third stage after decremental PEEP titration is a new recruitment for 30 seconds in order to promote lung recruitment, as the last step of titration might have allowed for partial de-recruitment. Use the largest PEEP achieved during the incremental recruitment. In our patient, this means we are applying a PEEP of 20 for 30 seconds. Now set the PEEP to the value associated with the maximal compliance. In our patient, this means we are setting the PEEP at 11.